Hi, and welcome to this edition of Sojourners Along the Way. I'm Patricia Ercolino, the producer, and hint, while I'm standing up, you know I'm not going to be one of the participants. But I am extremely excited about this program because 3 healthcare providers have taken time out of their very busy schedules to come and to be part of this program. I will ask them to introduce themselves. They're no strangers to this program because each of them has been on the program before. I'm going to put in a plug for my 2 visuals, and then I'm going to leave here, and they're going to conduct this interview themselves. And I hope you will enjoy it very much. My first visual is a cup, and it says half empty or half full. Because one of the things that I have been learning and seeing is we really need to change our perspective, and especially our perspective about health and about food. And that's what I'm hoping will be accomplished today, that you will get a lot of ideas about how you can do these things. I like these. These are my buddies. I want them to get a lot of airtime. This says, be plant strong. Our society has a fixation on strength. Well, we need to change our concept of that and become plant strong.
My name is Ruth Dudding. I'm the Director of Health Education at the Athens City County Health Department. I'm a certified health education specialist, and I have been doing what I'm doing for more than 16 years at the health department. I can hardly believe that myself. But every year we learn more about population-based health, and I think the community grows together in our efforts to make Athens County the healthiest place in Ohio, and I'm really excited to be a part of that work. And I'm excited to be here with the both of you, who I know very well, and I'm excited about the conversation we're going to have.
Thank you, Ruth. I'm Barb Nakanishi. I'm a dietitian at Ohio Health Oblenis Hospital. I'm also a dietitian in Logan at Hocking Valley Community Hospital. And I've been a dietitian for about 25 years. I'm very pleased to be here as well and excited to share some things with you. Thank you.
Great. I'm happy to be here too. I'm Dave Drozek. I'm a local physician. I teach at the Ohio University Heritage College of Osteopathic Medicine, and I have a practice with Ohio Health Oblenis Hospital in endoscopy and lifestyle medicine.
You know, I thought it would be a good way to start this conversation. Yesterday I spoke with a young woman who is like starting her career in public health. She's like, why? And this is a room full of health educators. Why do you do what you do? And I thought that was a really poignant question, because I think many people who are in public health or health have a personal passion or interest. And I'm wondering if we could just talk about it a little bit, because I know that you both have stories. I think my story starts with having a sister who had leukemia, and just wondering, you know, what makes people well or what makes people sick. And so that's where I started. And then really, my interests and my education had more to do with my own personal health and the benefits that I saw from changing my own lifestyle. And that's why I do what I do. And I think it's one of the best parts about it. There's nothing more fulfilling and exciting than seeing somebody change their life. So what about the two of you?
I can go next. I remember why I got into nutrition in the first place was I was just reading about job descriptions. I was a senior in high school, and I remember reading a job description about a dietitian, and it sounded interesting because I remember my mom and the neighborhood women seemed to always be on a diet and wanting to try to figure out what to eat. So I thought, well, it just seemed natural that it sounded interesting to study it. And then down the road, some things, you know, of course we all learn more. So at some point in my career, I saw this slide, and let's say I was probably 40-something, and this slide represents the typical American way of eating and what it might be doing to our blood vessels. This may have been done in men who have had autopsies, but I thought as a woman, you know, I'm very interested in this as well. So as you can see, there's some significant coronary blockage already happening from fatty deposits and atherosclerosis. So this led me to also pursue why we should eat more plant-based foods in our diet and less of other things. So we'll talk more about that later. And then also, I also then learned that about at least 30%, and correct me if I'm wrong, Dr. Drozek, at least 30% of cancers, of the most common cancers, can be prevented if we eat better, so, and change our lifestyle. So that was compelling to me as well, to just try to research the best way of eating.
Well, on the cancers, I know that as high as 70 to 80% of colon cancers can be prevented with a healthy diet. Only about 30% have a familial component to it, and the rest of them are lifestyle related. So, and then other cancers, different rates with different ones. But yes, it's an important factor. My own story, I'm a surgeon by training, but I'll not start with that. I'll move more recently, because I've been in surgery now for 30-some years. That's too long. But more recently, I became a patient, and that's how I got involved with lifestyle medicine. I hit my 50s, went to my primary care doc. I thought I was pretty healthy. I was a little overweight, and I had heartburn. I was taking some over-the-counter medicine, like a lot of people do. I didn't think much of it. But I found out that I had prediabetes, I had elevated blood pressure, I had a pretty high cholesterol, and that was alarming to me. I've taken care of a lot of patients with diabetes, and that wasn't what I wanted for myself. So my family doc did what most docs do. He pulled out his prescription pad and he wrote me prescriptions for a couple of medicines that I started taking. He never said anything about diet or exercise. So I took the medicines faithfully. I had side effects from both the medicines that were pretty uncomfortable, and I'd heard about the side effects from patients. So I got to experience that firsthand, but I did not want to have diabetes. So I was going to stick with it and work through it and be well. I decided to try the Mediterranean diet because I heard that that was a good diet. So I cut back on my meat. We were always eating lots of fruits and vegetables anyway, so that wasn't a big deal, but we cut back on the meat, and I thought, okay, things are going to be better. I gave up my afternoon soda and candy bar. I won't tell you what brand because Patricia said don't share the brand names. And so I didn't. I got rid of those, and I lost about 5 pounds, and I thought, great, things are going to be better. Unfortunately, the diabetes was actually progressing. So whatever I was doing wasn't working well or well enough. So I thought, well, that's just the way it's going to be. I'm going to be diabetic within 10 years probably and struggle with this the rest of my life. And then my wife went to the first Appalachian Health Summit in May 2011. It wasn't on my radar screen. I wasn't even interested. I was a surgeon. You know, that kind of stuff didn't have much interest for me. And she came home that night and she said, you have to come tomorrow to the community session because you don't have to have diabetes. And now my wife's a brilliant woman, and she's very active with Live Healthy Appalachia, knows a lot. She's got a biology degree, but she's not trained in medicine. And I probably not as tactfully as I should have said, you're not a physician. You don't know how this works. Diabetes doesn't get better. And she said, you need to come hear Dr. Esselstyn from Cleveland Clinic. So I did. I went the next day, and he talked about his study of end-of-the-road heart disease patients, how he took them into his program, and they were supposed to be dead within 1 to 2 years, and they were alive 20 years later. And he said, by the way, their diabetes got better, their high blood pressure got better, their cholesterol got better, they lost weight, and they're well and functional. And he got my attention. I was skeptical because I'd never been taught this in medical school. So I started reading, and I found out the evidence was clearly there. We made the change to a plant-based whole food diet. I got off all my medicine. I lost 30 pounds. I'm well. And because of that, I'm passionate about this, and I share it whenever I can. And that's as short a version as I can give. I could talk longer. I don't want to steal the show.
You can. We're fine with that. But you've also then shared that message with a lot of your patients. And I hope that whoever might be watching this show might be motivated by listening to the three of us to make some changes or to make some steps towards some changes towards a healthier diet. And I know that people think a lot of different things about change, just as you did. You were a doctor. You knew everything there was about change. But
I thought I did.
You thought you did. Well, now you do, right?
Not quite.
But, one notion that really can't be disputed anywhere is that we could be doing better on our fruit and vegetable consumption and changing our lifestyle. So I just want to tell you a little bit about what's happening at the health department and how these folks kind of fit in and how we all fit into each other, what we do. You talked about pre-diabetes. That's something we're very interested in the health department. About 35% of Ohioans actually have pre-diabetes. Only 10% of them know that they do. And you talked a little bit about cancer rates. In terms of Athens County specifically, about 60% of the people who die in Athens County do die related to a chronic disease. And a lot of times those chronic diseases, just like the cancer you're talking about, can be prevented with lifestyle change. So what we hope to do at the health department is link people to the resources that are in the community already to help them make a lifestyle change, to have the outcomes that you talked about, reversing or changing the future chronic disease that laid ahead of you. You don't have that issue anymore. And I think that is a really important message, that you don't, type 2 diabetes is not always inevitable. You can do something about it. And so we would welcome anybody who is listening who might be interested in learning more about anything that you might hear on the program today. The health department has a Healthy Connections Clinic. The phone number you can just call is 592-4431, and you can ask about the Healthy Connections Clinic. But you can come in, and we're really trying to help people, again, who are just starting down that disease process. They might be pre-diabetic. They might be struggling to get their blood pressure under control. We want to help connect you with resources in the community, like the Lifestyle Medicine Clinic that Dr. Drozek is going to talk about, like the Diabetes Prevention Program, like meeting with a dietitian so that you can really understand where in your own diet you can make changes. There's a really simple screening test, and I don't know if either one of you have seen this. The Centers for Disease Control and Prevention have a really simple 9-question assessment that really helps you identify if you might be somebody who has prediabetes. So that can happen at the health department. We can take your blood pressure for free. And again, we have a healthy living resource guide so that when you come in, we can look for screening opportunities, physicians, dietitians, physical activity opportunities, lifestyle change classes that we can help you connect with to set goals towards improved health. So that's something new for the health department. We're trying to be this resource hub because there are a lot of exciting things that are happening in Athens County in terms of lifestyle change. And the Lifestyle Medicine Clinic is really an important one. Do you want to talk about what that is, and if somebody wants to come and talk to you about the Lifestyle Clinic or join you, how they would do that?
Lifestyle Medicine Clinic has evolved out of my initial learning of lifestyle medicine and the training programs through the Complete Health Improvement Program, the CHIP program, which is offered through Live Healthy Appalachia here in the community. And it's a great program for especially people who are employed by Ohio University and other employers who pay for the program for them. It's a great deal to be able to go in there and have that information for free that can change your health. The Lifestyle Medicine Clinic developed kind of as a response to those who couldn't afford to go to CHIP. It's about $600. And that's out of reach for many people in our area. And a lot of people could pay it, but don't see the value of it up front. They would more than save that amount of money over the next several years easily by the reduction in medications and their healthier living, less doctor bills and things like that. But we were trying to find a way that we could offer material like this to people who couldn't afford CHIP. And the hospital administration at what was then Doctors Hospital suggested that we develop our own program. So using a lot of free resources online, the base of the program is Dr. Neil Barnard's Physician Committee for Responsible Medicine curriculum. That's available free online. And Barb also brought in the Full Plate Diet book, which we also use in our program. Those are two wonderful resources that are the basis of those, and they have many free videos online. So we built a 12-lesson program, and we have a free website, www.thelifestylemedicineclinic.us. Anybody can go there and make use of any of those videos, go through the program on their own. It's about 2 hours per session. However, people do better in a group setting. They do better when they have somebody to hold them accountable. So there's some people that can just pick it up and do it and make those changes, but others, most of us, need that group kind of scenario. So we offer group classes. There are free community classes that the hospital offers once a month, the fourth Wednesday of every month. That's Ohio Health Oblenis offers those. We won't be doing that in the summer, but most of the other months we do. We call those Wellness Wednesday. They're 2-hour classes. We provide healthy food and educational material for everybody to come learn about things. We have a topic each month. And then I have an office-based group clinic as well. Currently we're doing 1.5-hour sessions. We do 6 of those with a group of people. So again, they get that group dynamic. And then there's some people that want accountability, but they're just shy about being in a group with people, or maybe their work schedule won't allow it. So I see patients one-on-one and go through the same material and then give them assignments to do at home, and then we get back together every couple of weeks and review how they're doing. So there's lots of options on how the Lifestyle Medicine Clinic can be applied to people who are interested in using the material.
And so tell me about the Wellness Wednesdays. Can anybody come? Or is that specifically maybe for people who are already participating in your clinic?
No, it's available to anybody. We do ask that people call in or email us an RSVP so we're sure we have enough space and we have enough food for everybody. But the last 2 months, for example, we had about 20 people each time. So that's available to anybody in the community who would like to come.
Nice.
Someone still RSVP and come to the last few sessions that
Oh,
you're
definitely.
having?
Thanks for asking that, because these are standalone. Each month is a standalone topic. It's not required that you have any of the other ones. And idea is my hope is it's more of an introduction to a lot of people to this so that they get interested and want more material, maybe via chip, maybe do it themselves online with their spouse or their family, or come to one of our group classes. It's kind of meant to be an introduction to get people interested.
Yeah. And I think group, you had mentioned now a group class is really important, that dynamic, because what I have witnessed is that if you're not the person maybe who's making quick changes, but somebody else in your class is, it's almost as good for you to see somebody else being successful. And I know that it's a commitment. It's about 9 weeks. Is that how long your class is? How long is your clinic class?
Currently we're doing a 6-week version.
6
We were
weeks.
doing 12 weeks, and we found out that a lot of people were dropping out after about 6 weeks, and it may be that was all they needed, or maybe the course got too long, or they got bored, I don't know. But we were getting, with the 6 weeks, we were getting just as good a results. So whatever they really needed, they needed in that first 6 weeks in particular.
But again, I think that class dynamic is really important. And so, what's nice is that there is CHIP, there's DPP, there's the Lifestyle Medicine Clinic, because they don't always happen at the same time. So if you might miss the beginning of one, you could jump into another. I've also seen that many people do multiple classes.
Yes.
People who do DPP also do CHIP or Lifestyle Medicine.
Yes.
Why do you think that they do that? I have my suspicions, but what do you think?
A lot of people say, I'm coming for a refresher course. I've had people
Yeah.
take my program more than once because they feel like they need that repetition. And when you get presented the material, similar material from different perspectives, it helps solidify that. So I think there's a real value to that.
And I know that cost is a barrier sometimes for people with CHIP, but I have heard lately that there are some insurance companies that are reimbursing some of those, I think under certain conditions and scholarships. So, you know, if your class that you really want to go to isn't, you know, matching up with your timing, maybe there are scholarships available or other ways to pay. But I think what's best about it is the result. And I bet you have a lot of stories. I bet you have a lot of stories about people making a change and taking back their health. I mean, you have a great story. Everybody loves to hear that story. In fact, whenever I introduce you to someone, I just beg you to tell that story because it's so powerful, it's so impactful. But it's not unusual.
No,
when
not
people
at all.
really do make that commitment, it's empowering. They really can take a hold of their health. So tell us some stories about that. I mean, what have you seen in terms of what people have been able to do with lifestyle change?
Oh, wow, there's so many. I've seen people get off of their insulin, get off of their medications, lose weight, to the point where they've been able to increase their activity. People who were disabled with arthritis are now able to get on the ground and play with their grandkids. You know, and just on and on. Yeah, there's so many stories. The CHIP website has more and more of their videos that show stories of people that have had great outcomes. So yeah, it's there. It works for people who are willing to make the changes.
And I'm thinking of a few young women who had arthritis or had knee pain, and you know, just thinking of some young women. You normally think of that as an older people who are having chronic complications, but just thinking of some younger women who have had some chronic issues and how they were just so pleased that they felt better to be able to play with their kids or just be more productive at work or different things like that.
You know, I think when we think about lifestyle change classes or programs, we think about the big, you know, diabetes, blood pressure, cholesterol. But I think I have also seen some people who talk about how they feel. They just how they feel, their emotional and mental well-being, right? I think that was the most surprising comment that I heard someone say one time, is that their crying days are over. Like it really did. It's a systemic thing, right? It's not just an organ that they're working on. It's not just one thing. It's everything, right?
Yeah, two of the tests that we're doing on people, or questionnaires that we're doing for the studies, we've been studying the results of all of our programs, both for the CHIP program and for the Lifestyle Medicine Clinic, before and after. One of the questionnaires is a Beck Depression Scale. It's not real detailed, but it's a series of questions to assess somebody's level of mood, in particular depression. And we also use another survey that's called RAND SF36, which is just kind of a sense of well-being, how well people feel overall. There's a combination of objective and subjective findings in that. And almost universally, they improve. And even with minimal lab changes and minimal weight changes, for some people, they just feel better. And it's exciting to see that. We have a paper we're working on those findings that we hope to have published at some point in the future. But yes, people feel better when they participate and make the changes.
Yeah, and that's huge. Sometimes that's what all people want. Mm-hmm. Barb, why don't you tell us what it is we should be eating or could be eating to make us feel that good?
Well, I really like this full plate diet, because when people go to the dietitian, they're scared that the dietitian or the doctor even is going to tell them what not to eat. And so what I love about this full plate diet concept is that you can have a full plate of good for you food. And what I do in my practice is just trying to get people to have half their plate full of vegetables. But this full plate diet, and you'll see on the screen later that there are several examples of how do we incorporate more vegetables into our day, and fruit as well. So I think about, so many people tell me I like spaghetti. I like, they come to us, when they're first, wanting to lose weight or have better health, and, a full plate of spaghetti, a couple pieces of garlic bread, and no extra vegetables. So I work with them on maybe adding zucchini or something like that to their sauce, or at least having shrinking their plate of pasta to about half the plate and then adding some vegetables to it. Then some other things, stir fry is an easy way to get some extra vegetables in, add some extra vegetables there. Just adding fruit to your cereal, making sure you do eat breakfast and not skip it the first thing, but there's some good examples about how we can, let's say the average person eats 10 to 15 grams of fiber a day. And so we're trying to get people up to 35, 40 grams of fiber a day. So I thought it was phenomenal that only, that you can eat 15 more grams of fiber than what you're currently eating and still just naturally eat 200 calories less. So in a public health standpoint, that helps people maybe lose 20 pounds a year instead of gain 10 or 20 pounds a year. So think about the public health we can benefit just from eating more fruits and vegetables. And I think as a dietitian, we've talked about, eat more vegetables, eat more fruit. We've talked about 5 a day for so long. And how do we get the message out in a positive way that people don't just turn off their ears? I'm thinking, how can I re-say the same thing but in a different way? So I like the full plate diet in the sense that, it gives some new strategies about how to help people eat more fiber and more plant-based food. So again, there's several, if you remember, there's several examples in here about, on a sandwich, I told a lady the other day, if you're having peanut butter and jelly, you don't need the jelly, why don't you put the fresh fruit on your sandwich? And the lady said, I never thought of that. So it's just up to us to help people to work the fruits and vegetables in, and they're going to feel more full eating more fiber. And it's like we said, it's going to help you maybe reverse some coronary artery disease, maybe prevent some cancers, and just overall feel better. So that's exciting for me to help people feel better. The one way I'm going to start telling people to eat more vegetables, guess what? I just got a spiralizer for my birthday. And a spiralizer, if you haven't heard of one, it's a device that helps you to turn hard vegetables into spirals that look like spaghetti. And it's just, so last night I opened up my gift and I spiralized a sweet potato. And another thing I wanted to share with you is that sweet potato raw is going to taste different than the sweet potato cooked. So if you think you don't like sweet potatoes, try them raw, and they were so good. I just started eating them right out of the bowl. And of course, if you need help into knowing what to do with these spiralized vegetables, you can, if you don't want to eat them raw, that's where cookbooks come in. This one, like I showed you, has some zucchini on the front that they've cooked and probably put some pesto sauce with. And then for more ideas on vegetables, this version of Vegetarian Times, which was back in October, had a recipe in it with spiralized butternut squash, spiralized apple, and then some walnuts and some, must have been a balsamic sauce on there. And in this article too, there's the recipe, but then there's also a few types of spiralized tools. And you can get them with any income. There's some that are low cost, and then there's one that's maybe up to $50. So
right.
There's handheld versions that are lower cost. So depending on your budget,
like a pencil sharpener, right?
Yes,
That's
yes.
how. Yeah, that's.
So I like to share with people. You can roast your vegetables. I grew up just boiling them in the water, right? My mom just pretty much boiled them in water. That's what I remember. So now we can grill them on the grill, we can roast them in the oven, we can spiralize them. There's just so many different ways, and so that's what I want to inspire people to do.
I never thought about eating raw sweet potatoes in that way. Now, I'm going to have to try that.
I'm going to put them on my salad, or I just ate them out of the bowl because they tasted good.
Yeah.
I think it's interesting when we think about maybe some of the challenges or barriers why people don't eat more fruits and vegetables. Maybe, I look at the spiralizer and I think, this is attractive because it's fast, right? People want fast food. We're hungry, we want to eat. And I think that's part of the lifestyle change too, right? Is kind of rethinking, maybe taking a little time to prepare your own food really is a good thing. And what I've learned over the last few years, preparing my own food more often, I really love that process. I love picking out that beautiful food. I love the way it smells when I'm preparing it. I love tasting it as I'm preparing it. So that's a change that happened in me that really motivated me towards better health, is really building those skills and that relationship with my food. I really love food. I do.
And you know what the good news is? My daughters, who, sometimes I don't always eat a vegetable, I say as a mother, I don't care what you eat, you get home before I do, just put a vegetable on your plate. Sometimes they do, sometimes they don't. But when I got the spiralizer last night, they're like, oh yeah, we'll try that. So just colorful and fun. I think that's just another tip and tool that we can use for ourselves and our families.
And there are other resources too, like I know your wife is a cooking coach, right?
Yes.
So there are Live Healthy Appalachia cooking coaches, and if you get on the Live Healthy Appalachia website, if you're somebody whose interest is a little bit piqued by our conversation here, you can, and maybe you want a few more skills related to cooking, you could look up a cooking coach near you. They're all over the county. I think they're in the Plains right now. So.
Another resource we use in our classes are Jeff Novick's videos. They're called the fast food. It's the fast food series, but it's healthy fast food, and even I can make those recipes. It's really nice. So I have several dozen of the videos that we use. I lend out to our patients to watch and then bring back. But he starts out with showing you, have these basic items in your pantry. They're all affordable. Actually, this food, and you run the numbers, and we've run the numbers here locally, my wife has, and it's less expensive than eating the normal way that so many of us eat when it's animal-based. So he shows you clearly how to have this set amount of food in your pantry, these items, and with this you can make a series of very simple recipes in 10 minutes that are very tasty, and they're easy. Like I said, I can even do it. And of course my wife does it so much better because she's a master with spices and making changes and adjustments. But it's been a way we've seen work successfully for many people who don't have a lot of cooking skills and just need to know how to do it, or somebody who doesn't like to cook, just wants it done, or somebody who has a work schedule that doesn't allow them a lot of time. It's a valuable resource, and we have those at the library here in Athens.
And let's talk about a few of those food groups. I mean, the people in the audience might want to know what those things to keep on hand. I mean, it's a bean, trying to have a certain kind of bean in your pantry, or having maybe tomato product in your pantry, whether it's canned tomatoes. So you pair a tomato product possibly with a bean and a grain and a vegetable. So you want to have, I think that's, and then a spice. And then so one day you can make an Italian and use a white bean and a pasta of your choice, and vegetables and maybe Italian spices. And then when you make a batch of something another day, you can use Mexican spices and maybe a different kind of bean, like a black bean. Is there anything else? But that's kind of
pretty much it. Yeah. Just different. Like you'll go with the starch would be maybe a potato, a sweet potato, a white potato, whole grain pasta, rice, which would be brown rice. So those would be in your starch category. And then the beans can be, to be in the 10-minute range with the rice, he uses the Success brown rice, or they have generic forms that are similar to that are already partially pre-cooked, so they're 10 minutes, boil the packet. Beans, you can get the canned beans, be sure they're the low sodium beans, or I guess they have a new line out here locally at the grocery store that's actually 0 sodium added, which is even better. Or if you have a little bit more time and you want to save money, is you soak your own beans. My wife does this every week. Usually it's Friday night. We got 2 big pots of beans on the stove, and we soak them overnight. She soaks them overnight. I'm taking credit where I shouldn't. And then next morning she simmers them until they're ready, and then dips them up into, after straining them, dips them into Ziploc bags that go in the freezer. About 1.5 cups is equal to a can. So you have your can of frozen beans, nothing's added. Takes a little bit more time, it's a little less expensive. So that's a nice way to do it if you have that time and desire, or you can get the canned beans. The other thing we do with the fruit, Jeff Novick uses a lot of frozen fruit, which is fairly expensive here. But what you can do when the fruit is in season, and we have a garden and we have lots of raspberries and strawberries, more than we can use during the time they're ripe, is you get the fruit, or you can go to the grocery store so you can get those inexpensively. We'll take a cookie sheet, rinse the berries, dry them off, put them on the cookie sheet, put them in the fridge for 10-15 minutes till they just start to get a little crusty from the ice starting to freeze, and then you put them into a Ziploc bag. And then you've got them easy. You take out a handful or a cup or however and I do that every day with my oatmeal, have some of our raspberries from our garden. That's a very cheap way to do it. You buy them when they're in season, freeze them, very simply, keep them in Ziploc bags, and you have them later. He also uses the frozen vegetables, which are inexpensive. They're like $1 a pack, and there's no waste. It's all cut up vegetables ready to put into the pan, however you're going to cook with it. So you don't have to throw the core away, and you don't have to worry about that. So basically, with those kind of things and some Mrs. Dash spices, they're wonderful mixes that are all ready to go, so you don't have to have a lot of different spices on your shelf. We do, because my wife knows how to use them all, but if you don't, you just want something that tastes Italian, you get Mrs. Dash's Italian mix, you got it, and you're ready to go.
You know what? I have frozen strawberries on a cookie sheet in my freezer right now because our local FFA, Future Farmers of America, did a sale of a flat of strawberries, and so I've got them in my freezer now, and I did half yesterday, and I'm doing the other half today.
I think that's really important, and I think you brought up a good point, Dr. Drozek, that I think one of the barriers that people tend to believe is that eating healthy is expensive. But if you're soaking your own beans, you're cooking your own beans, you're getting your fruits and vegetables, you're freezing them when they're in season, it can be affordable.
It's very affordable. It costs less, and we've run those numbers, and we know here locally in Athens, it costs less to eat this way.
Do you have any additions to that in terms of cost, cheap ways to approach healthy eating? We talked about the farmer's market, but even if you're a shopper at Aldi's and Save a Lot, I think I talked to the Save a Lot folks one time, and they said that Athens kind of tends to get all the dry beans that surrounding stores don't quite sell, but you can make those choices easily at those other stores as well. So it's exciting, and I think that's another good place to talk about, because you talked about your pantry, which I think is essential. You really have to, because you're going to eat whatever is at home, right? But all of that starts in the grocery store, right?
Yes.
So do you want to talk a little bit about some good strategies for making good choices in the grocery store?
Yes. If you usually, the healthier foods are around the perimeter of the store, and a few, of course, if you have to get the canned items, you can have to go into the center of the store. But I think that's the easiest. The produce is in most stores when you walk in, so you can actually shop quicker if you do more plant-based eating, because you can get in and out around the perimeter of the store, and it's actually, we've had clients who said they've saved time off their grocery shopping trip.
I really only go to 1 or 2 aisles in the grocery store typically when I go shopping, so that's great. And I'm thinking about the day, if you're walking through the day of somebody and all the choices that they make for healthy eating or can't make. So it's going to be in your kitchen, it's going to be at the grocery store, but we are a culture that likes to eat out too, right? And fortunately for us, we have some fantastic places to eat out. Do you want to say anything about that, those kinds of strategies for eating out? Fast food or not?
I'm going to talk about just more of the fast food. There are a couple items on a couple of menus that may not be, they're still processed, but if you're trying to start out by eating less animal products, Burger King does have a veggie burger, and if you don't see it on the menu, they do have it. You just need to ask for it. You can ask for it with or without mayonnaise. I think it comes with pickles and mayonnaise and ketchup. Taco Bell has some bean items. They have an item called the 7-layer burrito. Of course, it does have sour cream, but I know that it has guacamole and beans and rice in it. So if you're just starting to think about what is plant-based, there are those opportunities.
At Taco Bell, if I can interject, on almost any of their items, you can get it fresco style, which they leave the cheese and sour cream off, and they put diced tomatoes and peppers and their mix, their salsa mix on instead. So a bean burrito, instead of getting the bean burrito that has all the greasy cheese, get the bean burrito fresco style, and you'll get tomatoes, onion, and pepper on it instead of the cheese, and it's great.
So I have to try that 7-layer and see if they'll make it special with fresco style with less. Yes.
And now with their app, it's pretty interesting because Taco Bell's one of my favorites if I have to get something on the go. But they have these apps now. You can order specifically what you want. Like if I'm at the hospital in Nelsonville and I'm on my way and I only have time to grab something quick, I can order exactly what I want, hit the button, I walk into the store, they call my name, I pick it up and go, and I've got it ready to go. I'll sit there and eat it in the parking lot before I get on the road, but it's exactly what I want, and you can leave off all the options are that detailed. You tell them specifically what you want. They'll put romaine lettuce on, they'll put extra beans on, they'll leave the sour cream, leave the cheese off, and you can get a reasonable meal. It's not, their bean mix is higher fat than you probably would have at home, but if you have to eat out, that's a better option.
Mm-hmm. And I know there's some good sit-down restaurants, but I haven't gone out to eat lately, so, I mean, there's some good, I do have something, though, the barbecue place.
Kaiser's.
The other day, I was at an event, and the vegetarian option, had tofu in it. It was a tofu-based option, and it was so good that the tofu was, the texture of it was just right, so that it was just so good. So that's what I want to say about other things, that if you thought you didn't like tofu, or you're not sure if you like tofu, and you had it in a cube, and now you want to, don't be afraid to try it crumbled. It has a better taste and texture in some foods, so that was good.
Yeah, and Chipotle, although they've had some issues recently nationally, we go there a fair bit and get their sofritas, which is tofu-based. It's wonderful. It's seasoned so good. And you get your brown rice and your beans and your vegetables and guacamole if you want. We leave the sour cream and cheese off. It's perfect. You can get this nice plant-based meal there. The other one that's when we're traveling, that's kind of our go-to is Subway. And you can go to Subway, get the whole grain bread, and just have a veggie sub. We leave the meat off, we leave the cheese off, and you can pack it full. And they have an app as well. That's the other one I'll use from work. If I know I don't have time to eat because I got a class to get to, I'll dial in exactly what I want. They've got my favorite already in my app, so I hit the button, drive to Subway, walk in, they've got it, walk out, and I'm ready to go.
That's great. I think in general, if you're, we find ourselves in situations where we may be in a place that isn't your first choice, but you're with a group. Typically, many times you can choose a couple of sides as opposed to an entree. Again, if you're trying to be conscious of quantity, because oftentimes a restaurant serving size might be larger than what you're typically eating anyway. So just eating a couple of sides, just about everywhere you can get a baked potato, steamed broccoli, a salad, some steamed green beans. Again, probably not your favorite meal at home, but some good choices if you're eating out. And again, being in our community, we have the luxury of our local restaurants that do a fantastic job. And when I'm not in Athens and I'm eating out, I struggle so much.
I know we can't name all the restaurants, and we might offend somebody, but I know Casa, has wonderful meals, and it's called Something in the Hills. They have an option that's beans and rice and on the wheat tortilla.
Yep.
I can't remember the full name, but
and
anyway.
Louis has their chip menu, and it's wonderful, and you can be confident you're getting some healthy food there. Yeah, if we're going to name names, we got to.
Plus, Casa Village Bakery.
Yeah,
there's so many.
Catalyst.
There are so many. Athens is a great place.
It's so.
And
so
you
that's
can ask, even if you go to a restaurant that doesn't have those kind of options obvious. People are so willing to make adjustments. And even when we're traveling, we get that some. And other times we get people just look at us and say, no, what you see is what you get. And yeah, it's disappointing sometimes when we're not around here, but people in Athens are great.
Yeah. Yeah, we're just lucky
We're
to be here.
spoiled.
Yeah, we are very spoiled.
Another thing along that line, if you plan ahead to avoid eating out or to avoid eating so much when you eat out, because if you're hungry and you go, you know, every day I take in my lunch. Right now, those little peppers are,
Right.
oh, they're so sweet. They're like candy. They're so good. And they're inexpensive, so I'll have some of those carrot sticks, an apple, things that I can munch on in the car. You know, so if I'm on my way to a restaurant, I can eat those and then be less hungry and less likely to order something that I will regret in the restaurant. So if you can take the edge off the appetite, those things in the restaurant, when you walk in and smell the steak or something like that, it may not be quite as appealing to you if you've already had something else in your stomach.
Yeah, those are great ideas. I even like to bake a sweet potato and just take it along with me. It's already in the skin, so I just peel it like a banana, and it's delicious. Yeah, that's great. So being prepared, that's a little piece of this. This doesn't come automatically, right? This takes a little bit of effort and preparation. But when you're talking about the benefits that we talked about, the feeling good, preventing diabetes, getting your blood pressure and cholesterol under control, it's minor. It's a minor inconvenience that reaps plenty of benefits. But what do you think are some other barriers that people struggle with in terms of making a lifelong change? You know, I think that as Americans, we tend to approach maybe weight loss or health changes, you know, hard and fast. We want to see results and lots of results, but really in an attempt to do something for just a short amount of time, something that we don't intend to do. So how do we get beyond that?
I think one thing that comes to mind is family. You know, I talk to people in the office who would say, well, my husband would never go for that, and we cook together, or, I mean, that's one thing. Anything else that comes to your mind?
That was the first thing that came to mind, and I see that again and again, and I encourage people who are in that scenario where their spouse or their partner at home isn't on board, find somebody else. Find somebody outside the home that can be your buddy, your partner. You can go exercise with. You can share recipes. And for the spouses that, you know, I want meat on my plate, you know, so fine. Make what you will eat, and then throw that pork chop in or that piece of chicken for them, but see if you can leave it alone. Or there are some, you know, if they're not, I mean, there's some people that are just, no way, I'm not going to do it. But there's some people who you might be able to tease into it by using some of the meat substitutes. And my wife, again, is great at fooling people who come to dinner at our house. You know, they're eating and they're, we thought you were vegetarian. You don't know what you're eating. You know, one of the products out there that's really interesting is seitan. You know, it has meat consistency. It's made from gluten, so if you have a gluten issue, you don't want to use that. But it has a nice, chewy consistency like a piece of meat. It's a little bit pricier. My wife even makes it sometimes from the gluten flour. Mm-hmm. I'm not sure what she does, but I see it on the plate, and it's good. So that's one thing you can do that can fool people into getting more plant-based. The other thing that's really helpful is TVP, total vegetable protein. You can buy it in bulk. You can use it in your burgers. If you make your own burgers, you can go half meat, half TVP. So you can sneak it in. Or if you're used to throwing ground meat or ground beef or something like that into a chili or into spaghetti sauce, you can use the TVP. Or into soups, somebody will think it's little bits of meat in there. They won't even notice it because it takes on the flavor of everything else, and it's great. So those are a couple of things that can be done. And then there's other transition things, you know, like the sausage and some of those brands, the artificial or the meat-like plant-based things, but they tend to be more processed. They're high high in sodium and other things that you may want to avoid. But I tell people these may be reasonable transition foods. If you're somebody that has to have that sausage in the morning or has to have that bacon, well, try the vegetarian type bacon and see if maybe over time you don't need it at all. Those are transition foods.
Because there is a continuum, right?
Yes.
So depending on where you are on this range of readiness or activity in terms of incorporating whole foods into your diet, even making a small change, right? Can you tell us a little bit about just making that small change and the benefits that we can get? Just moving that direction.
I can start just quickly. I know there's some literature out there that says, pick 3 things a week. Work on, is there something that you like already that's plant-based? Is there something like spaghetti that you can maybe put lentils in? At the hospital, we had a marinara sauce, and we tried one this last week. We put lentils in it and offered that as an option. So just trying some things you do, like sloppy joes. We know we've tried either black bean sloppy joes. We've tried lentil sloppy joes. And even trying it instead of lentils, maybe even the textured vegetable protein could give that feel. So those are think of some things that you would normally have meat in that you can change up a little bit. Or, you probably would say too that you can try maybe a smaller piece of the animal-based protein. If you're a 6 ounces of meat, some of my clients, they just have the size of meat, the way it's packaged in the container. They don't even think twice about cutting it in half. So we work with cutting your animal-based protein in half, and then I just think that no matter where you are, like we said, it's not enough people eat enough fiber. So I just think if you get the vegetables and fruit on your plate, that's the first thing that I try to work with people.
Yeah, just a comment about protein, because people have this ingrained in their minds that they need to eat more protein, and that's incorrect. The studies have shown clearly that we would do better with less protein in our diet. And unfortunately, when people think protein, generally they think meat, because that's kind of what we've been given in the advertising. And meat generally is more fat than protein. If you eat a plant-based whole food diet, you will automatically get all the protein that you need. And there's plenty of vegan athletes who compete at the Olympic level that can attest to that. And if you think like Dr. Bernard likes to say, look at an elephant, look at a bull, look at a gorilla. Where do they get their muscle bulk? It's all from plants. You don't need to have animal protein at all. And it's probably, the studies show, more likely detrimental to us than helpful. If you are going to have it, one other thought along that line is, like you were saying, minimize the portion. So use it more like a condiment. So if you're used to a big piece of meat, dice it up, and maybe if you're stir frying, put a little bit in rather than the big piece. So move away from a big portion and move down toward a smaller portion. That idea of the continuum, or like I have some people who are ready. I was ready. I was ready to make a change, whatever it was. I just needed the facts. But there's some people who aren't ready. They want to test the water. And what we do in our program, we deal with both. We deal with those who are ready to go. Just tell me what to do. I'm going to do it. And then others that are, I want to experiment. So we set goals each week. I have everybody set a nutrition goal, an exercise goal, a stress management goal, and try it. And then next week when you come back, tell us how you did. And a lot of people, then they get that positive feedback. And like you said earlier, they hear other people's stories, and then they're more willing to go the next step.
Yeah. Would you agree with me because sometimes I think it's more, if we can just get people to put more vegetables in their diet, that's more important than taking things out. Because I think sometimes people get fixated on taking certain things out of the diet, but they're not really, putting all of the best things in. So would you agree with that?
Yes, I agree, and I like to set goals as well. I like to have people try new vegetables. I say every payday, can you try something new? Because many of us, I have the certain handful of vegetables that my mom liked, that I ate growing up. So in my adult life, I've tried several new vegetables. So I encourage people to, yes, set a goal, try one new thing a week if you can. Everybody's busy, so once a week might be too much. Maybe every other week, every payday, once a month, whatever it is. I've had several people who have never tried some of the beans. They've never tried black beans and some of the other beans. So just encouraging them, just try one new thing.
Yeah.
A recent study addressed that. Calorie restriction just doesn't work for the majority of people for very long. I mean, they can do it for a while, but they get away from it, and it's painful because you go around hungry if you're eating less than you normally eat. So a study broke the groups of people into two groups. One group, they say, okay, 500 calories less a day, and these were patients who had diabetes. So they were told 500 calories less a day. The other group, they told, eat a can of beans a day, 5 days a week. And when they compared the results, the people who were eating the beans, eating more or eating differently but not going hungry, had better results in their blood sugar, their weight loss, and their blood pressure control than those who restricted their calories. So I would agree. Fill up with the good stuff. That's the full plate diet concept. Mm-hmm. Fill up with the fiber foods. It pushes the calories out naturally because it decreases this concept of calorie density. The same volume of food has less calories when it's full of fiber than a food that's packed with all the extra fat without the fiber. And you don't have to go around hungry. You can be full and satisfied and actually lose weight and get healthier.
That's a pretty significant mind change because, my whole career, we've told people, eat 500 calories less a day. By the end of the week, you can lose a pound. So that's a significant mindset change for health professionals and for the patients that we see. So that's very interesting research.
The other interesting one is the carb restriction. We didn't even go there, but maybe I will briefly. There is at least Dr. John McDougall, who's a lifestyle medicine doc out there, promotes starch, complex carbohydrates, not the processed cakes and pastries, the complex carbohydrates, and he promotes that as being the main source of our calories, and I think he's right. I think we are designed for complex carbohydrates. To restrict them causes a problem. We need to restrict the processed carbohydrates. So I tell people, eat pasta. And they say, no, it's a carbohydrate, I can't eat it. I say, yes, you can. Get the whole grain, 100% whole grain pastas. Eat the rice, eat the brown rice. Like Dr. Barnard says, prior to fast food in Japan, he says they were all eating white rice and they were thin. Yeah. So it's not the white rice that's the issue. It's the other stuff we're putting in with it.
And we can teach people what other grains are out there because today I was mentioning to a client that there's barley, there's the whole wheat berries that we've not, it takes a little longer to cook, but on a Friday or Saturday or whatever day you have a day off that you can use it like rice, but it's a whole grain and you can make it savory or you can make it sweet, sweeter with fruit, and it's just, it's a learning curve to help people with new recipes.
Well, I hope that somebody listening is ready to take a step. Again, if you have any questions or don't know where to start, you can call the health department. You can contact the Lifestyle Medicine Clinic or ask your doctor if you can see a dietitian to start a change.